What is hydrosalpinx? The definition of hydrosalpinx is a collection of watery fluid in the uterine tube occurring as the end stage of pyosalpinx. In other words, if the tube's got a clear watery or dark watery, brown watery, the findings at that time which make the diagnosis of hydrosalpinx, it's an end stage of a process. It means the tube went through acute inflammation and chronic inflammation with pus, and then that dissolved, then it become hydrosalpinx. Hydrosalpinx is caused by previous pelvic surgery, sexually transmitted infection, and endometritis, or even previous surgery. If we can have one fallopian tube that is affected by hydrosalpinx, it means fluid in the tube, and the other is not. Pregnancy is technically possible, but is not without risk and complications. A damaged fallopian tube can leak fluid into the uterus during pregnancy and cause miscarriage. But recent research also went and find out that hydrosalpinx have impact on the blood flow of the uterus itself, the blood flow of the ovaries, and even affect the implantation, because the blood flow to the endometrium where implantation is supposed to happen is decreased. Therefore, hydrosalpinx, it cannot be looked as an isolated issue which cannot affect your pregnancy. It's got a direct impact on the pregnancy if the one tube is without hydrosalpinx and the other tube is with hydrosalpinx. Some patients say, "Doctor, please, can I just have IVF? And please don't treat hydrosalpinx. Please don't take me to theater to remove hydrosalpinx. Therefore, because IVF is here, let's go straight into IVF and forget." Is it true? No. As I said before, IVF can be successful with hydrosalpinx, but that pregnancy have the high chances that implantation may not happen. Miscarriage is very high, and all the complications of pregnancy are very common in this patient with hydrosalpinx. Yes, IVF can help to bypass the role of the fallopian tube. That's true. IVF is the best option, but can cause complication if done before the blockage is removed. Hydrosalpinx must be removed or separated from the uterus before IVF. If we look at studies, which was done obviously in America, and look at the number of patients, I think this will try to explain what I've just tried to allude you to. This is an academic review. We're talking about 5,500 women undergoing IVF. In this group of patients, which was about 6,000, then they were divided into two major groups. Groups with hydrosalpinx going to do IVF, and a group without hydrosalpinx but tubal blockage and going for IVF. Those were the two groups. In other words, this is a randomized control study. The only difference that one hydrosalpinx, the other no hydrosalpinx, the treatment is the same, IVF for pregnancy. Looking first in all this group of patients by the way, they divided in this way: 1,000 with hydrosalpinx, 4,500 with tubal blockage, no hydrosalpinx. The embryo transfer which were done in this group, it was 8,700. In other words, almost double, 2 times. The patient had to come twice for the first and second attempt. They were all in the study. Hydrosalpinx group, which was 1,000, they had success rate of pregnancy of 20%. Blockage with hydrosalpinx, pregnancy rate 30%. Implantation rate in patient with hydrosalpinx 8%, and patient without hydrosalpinx 14%. Delivery rate, in other words, patient who take the pregnancy to term, those with hydrosalpinx 13%, and without hydrosalpinx went to 23%. Early pregnancy lost with hydrosalpinx 44%, without hydrosalpinx 30%. Therefore, this explains that hydrosalpinx, or a person with hydrosalpinx going through IVF, have got low implantation rate, got low pregnancy rate, and it's got high miscarriage rate. Therefore, it's very important to understand this study because it's a randomized control study. What treatment option available for me if I've got hydrosalpinx? Surgery is to remove, or surgical management is the best to remove hydrosalpinx, which you call salpingectomy. Laparoscopically, it can be done. And immediately you have done, remove the hydrosalpinx and the whole tube, then the pregnancy rate is high. Lesser surgical management can be done. Sclerotherapy is less invasive, is done under ultrasound, but the recurrency rate of hydrosalpinx is more than 80%. And it doesn't improve the IVF outcome. Repairing the blocked tube laparoscopically with hydrosalpinx is not recommended, and the pregnancy rate is very low. And even if you go with laparoscopically, you train only hydrosalpinx, the recurrence rate is very high. Now, IVF after treating hydrosalpinx with salpingectomy, you're looking at 40 to 60%. Therefore, definitely from the studies which we see, the golden treatment for hydrosalpinx is salpingectomy, because it increases your chances of success in IVF and it lowers your chance of miscarriage, and therefore it's a good management for patient with hydrosalpinx. Tubal disease is very common in developing countries that include Africa, India, and other countries. Therefore, we still need to study this condition in our center, and definitely it's higher compared to Western data, which we are using at the moment. Thank you.